Hi guys, it's Fibro Advocate here, Shana. I hope you're all doing well. It's very early in the morning. I just wanted to do a quick video in relation to graduated exercise therapy and my experience yesterday in the hospital. For those of you that don't know, I'm in physical rehabilitation as an inpatient post a 6-day ketamine infusion as an inpatient as well at a different acute hospital. I had a terrible experience, and I have had this previously with the physio session that I undertook on Monday. The physio decided upon her own merits that she was going to create a program for me that she felt was a little more, intense, I suppose, than I've previously been doing, which is basically stretches on the bed. And each day that has worked for me in the past because I have this routine every 3 months. She proceeded to tell me that, it's good for me to feel a burn after exercising, that we need to feel the burn to know that the muscle's working. I proceeded to explain to her that with fibromyalgia, chronic fatigue syndrome, or myalgic encephalitis, it is not a good thing to feel the burn. So I proceeded to partake in the exercises, which were very basic, except they included a reformer bed in the afternoon session, which was just simply doing 10 squats with my feet apart, shoulder length, 10 squats with them wide, 10 squats with them together, and then 10 sort of walking squats. Well, that was far too much for me. Previously, I haven't been on the reformer for years. And yesterday, as a result, I woke up at 2 a.m. in the morning with pain shooting down my spinal cord, all through my back. I could barely move my fingers. By the morning, I had pain everywhere, including my fingers, my knuckles, my wrists, my elbows. Some of you have probably experienced this, and I was in a hell of a lot of pain. I had taken 2 endone, a fast-acting Palexia, a slow-release Palexia. Then I had a migraine come on, so I had a zomegatriptan, and basically I was very sick all day and ended up vomiting most of the afternoon. So I was really angry, and that's really what I wanted to come on here and talk about. Was I was really angry at myself for allowing myself to be pressured into it in the first place. I was actually crying because I was in so much pain and because I'd allowed that to happen, when I know my body and I know myself that there's a very thin line with fibromyalgia and myalgic encephalitis, that patients who suffer from both have to tread very carefully. Yes, fibromyalgia can benefit from slight, small amounts of graduated exercise therapy in a controlled situation. However, people with myalgic encephalitis or chronic fatigue syndrome do not benefit from graduated exercise therapy, as it's been proven in the PACE trials throughout the US, the UK, and Australia. It is, and this is what I went on to tell the doctor yesterday, it has been proven it's detrimental. It sets people back, and it's possible that I could have a flare now for a week, a month, a year, who knows. At this stage, waking up this morning, I'm in a lot of pain again, and I still have I still have the migraine active from yesterday. So I've just had another zomegatriptan. But my point was, and my point about this video is that I've learned after almost 8 years now that I have to really stand up and let these doctors and nurses know and physios know what works for me and what I will and won't tolerate, and what, fibromyalgia and chronic fatigue is all about. A lot of them are not educated, even though they have studied pain management and possibly chronic pain management. They still don't understand the feeling of actually suffering with fibromyalgia or suffering with chronic fatigue syndrome. The pain, the exhaustion, unless you've had it, you can't understand it. That's the bottom line. And so I went on to speak to the doctor, told them that they need to redo the complete session for myself for physio. I would not be partaking yesterday, which I didn't, and possibly not today because it was far too much for me. So basically, the doctor agreed and we went from there. But it was a very stressful day, and I just wanted to come on and give you an update about how the doctor then spoke to me about patient advocacy and how it was good that, I spoke up and that I was assertive. And I agree with him. For years in the past, I had been pushed and would do physio for a couple of days and then crash for 3 months, do physio, then crash for 3 months, and I kept getting sicker and sicker, and it just never paid off. But since introducing just a gentle stretch, throughout the day on the bed, it has improved. My genuine strength in my legs and slight walking mobility. No, it doesn't mean that I can walk down the street. No, it just means I can walk to the bathroom and back when I'm in the hospital bed. And when I get home, it means that I can walk maybe a few steps before having to sit down and rest before going and sitting down on a piece of furniture. So I'm sorry if I sound like I'm rambling. I hope this helps some of you. Please let me know what you think in the comments. Let me know your experiences with, exercise or graduated exercise therapy, fibromyalgia, chronic fatigue. Have you had the same problem? Have you had similar experiences? Look, I look forward to speaking to you soon. This is being sent at ME Awareness Hour from Australia. Just want to say hello, let you know how things are going, and just put this out there. Take care, stay safe with COVID, and know that I love you all and love your support for me and support in general with fibro and myalgicencephillitis. Okay, signing off from Fibro Advocate. Big love.